And today I'm going to talk to you about disc herniations. Disc herniations are extremely common in the general population. In fact, you go to an amusement park, you go to Disneyland, you're going to see all these kids jumping around with their parents. Their parents are riding rides with them. They're having a great old time, but fact is, majority of these people have disc herniations or some degree of a disc herniation. And you're probably wondering, how are these people doing this? How are they getting by without having pain? I mean, they don't have sciatica, they don't have low back pain, they're not walking with a limp, they're having a great time with their family, they're living their lives. So just this concept should stimulate your interest of how important is a disc herniation when it comes to low back pain, or how important is it when it comes to sciatica. The fact is, a lot of these conditions are not from disc herniations, but rather people just have disc herniations at the same time. And the medical community started to really go gung-ho about the disc being the major cause of back pain with the invention of the MRI. What they did was they found people with low back pain and stuck them in the MRI machine, and they found that these people had disc herniations. Well, majority of people have disc herniations anyways from wear and tear of their body, but not everyone has pain with a disc herniation. So really, what came first, the chicken or the egg? I mean, we don't really know unless you had multiple MRIs. I mean, what came first, your disc herniation or the low back pain? There's no doubt in my mind that some people really do need disc surgeries based upon the severity of their symptoms and how much pain they're in, but majority of the people don't. I mean, I've seen so many unnecessary disc surgeries, it's unbelievable. And these people their bodies are changed forever. They're harder to fix. A lot of them are unhappy with the results, but some people are really happy with the results. But regardless, it should be held as a last resort. Only after months and months of unsuccessful non-surgical treatment should you consider disc herniation surgery. The treatment I use for disc injuries in my office is called active release techniques, or ART. ART has been considered a non-surgical and effective non-surgical treatment in many cases of low back pain, shoulder pain, sciatica, knee pain, and even carpal tunnel syndrome. It's rather unknown in the general population, but it's more popular in professional sports. And in fact, many of the NFL, NHL, NBA teams, and even Olympic medalists have used active release techniques and found success. In fact, I think the last 3 Super Bowls I watched, I saw someone, the camera panned over the sideline, and you saw someone getting active release techniques on the sideline. Normally what happens when you get neurological symptoms in your arms or legs is nerves will get entrapped within surrounding soft tissues because of scar tissue or fibrous adhesions. ART helps to remove these and restore that slide of the nerve, restoring the nerve flow to your arms or legs. Many people with disc herniations or low back pain can feel significant change in their symptoms within 3 to 4 treatments of about 15 minutes or so. Many cases of back pain or sciatica can be resolved within 6 to 8 or 8 to 10 treatments, depending upon the severity of the patient, and it varies from case to case. But fact is, it's better than having disc surgery. Your body's not changed. There's very few contraindications to this kind of treatment. For more information on active release techniques, please visit www.activerelease.com. For more information on different conditions, please visit my other demonstrations or visit my website. So this is an example of how I treat patients with low back pain and disc herniations in my office, using the traction table and active release technique. The reason why the table is so great in conjunction with active release technique is because it gives me a lot of authority on the muscles and ligaments in the area, releasing the scar tissue that builds up over a long time and over multiple back injuries. Many patients report that after they get off the table they feel a lot looser, increased range of motion. However, some people do feel that for about 48 hours after the treatment they feel some soreness, a different kind of soreness.